Linda, you've been a patient at the Mayo Clinic for many years.
Many.
You have a storied health past. It has a lot of educational points for a lot of people, including me. Back in the late 80s, you found out you had some health issues.
Yes.
How did you find out about what was going on? Take us back.
My mother was very ill with kidney stones, high blood pressure to the point that it was a malignant high blood pressure crises. And my uncle at the same time was here at Mayo Clinic, and he had bone cancer, and he had 4 years earlier a tumor removed from his chest. It was a thymic tumor. And when they did the frozen section, they said that it was not cancerous, that everything was okay. When my uncle came up to Mayo, they looked at the slides again and saw that it was a cancerous process. And at that time, he actually was the first one diagnosed with MEN here at Mayo. And then my mother was called and told that they thought he had something called multiple endocrine neoplasia. And my mother was at the University of Michigan Hospital, and she had Dr. Norman Thompson as her physician, and he was already starting to kind of put the symptoms together and the syndrome together, and he actually diagnosed my mother as having MEN.
So your mom knew that she had multiple endocrine neoplasia, and there's a couple types. Type 1 tends to involve the pituitary, the parathyroids, and the pancreas.
Right.
And the type 2 typically involves the medullary thyroid cancer and sometimes pheochromocytomas, and as well as other things. So your relatives had MEN type 1 with the parathyroid, pancreas, pituitary variant.
Yes.
And you knew that your mom had MEN.
I knew my mom had MEN, but at that time when MEN was just being discovered, we did not know there was a type 1, type 2, type 2B. We didn't know there were different types.
Okay. And as a young medical student, I learned that it was multiple endocrine adenomatosis, and it was called Wermer syndrome and Sippel syndrome, and so it's gone through a lot of changes. So when did somebody come to you and say, you have MEN?
I, at the age of 18, started having kidney stones. Lots of problems with kidney infections, always high calciums. I had infertility problems. I could not get pregnant. I did not have regular periods. I could go for a year without having a menses at all, which was very frustrating trying to have children. And I was in my 30s when I first started this process. And everyone kept, drawing the blood levels and things seemed to be okay, but there was always a high calcium level. And I actually, looking back at things now in the history of MEN, people would jokingly tell me, oh, you're so healthy, you have such a high calcium level. Well, what people didn't know then is that it was causing infertility problems. It was causing my kidney stones. Luckily, I was able, with fertility drugs, to have children. I had twin boys, and this was the same time right after that my mom was being diagnosed. So a couple years went by, and we were told with the MEN that not to worry about having children. It was definitely not genetic, and it didn't seem to fit a familiar pattern at that time, because that was a concern of ours. And then when I was definitively diagnosed was in 1990, and I did see Dr. Norman Thompson from University of Michigan, and did have, at that time, a parathyroid hormone test had been developed, so I also had that. That was in the high hundreds. High calcium levels, kidney stones, every 6 months, kidney stones, going through lithotripsies. And so I was definitively diagnosed in 1990, and I lived in the South Florida area, so I was referred to Jackson Memorial down at the University of Miami.
To have a neck operation.
Yeah.
So what I'd like to focus on at this point now is we know that you have MEN1, and that has concerns about pituitary, pancreas, and parathyroid. You've gone through multiple surgical operations, and I'd like to touch on a couple of them a bit.
Okay.
And I'd like to hear from you a couple of pearls of wisdom as somebody who's a patient, but also as a nurse and an educator and terribly talented and intelligent with a variety of things. First and foremost, you had an operation for parathyroid problems. Your calcium was high, your PTH was inappropriately high.
Yes.
After that operation, did the calcium go low? Did it get back to normal after the first operation?
No.
It didn't.
It did not. In fact, I waited 4 months to have the operation because they were just developing a rapid parathyroid hormone test that could be done on a patient intraoperatively. And I had 2 parathyroids removed, and the parathyroid hormone level never went down. They couldn't find any more at that time. And so we had the benefit of the parathyroid hormone test. However, only 2 parathyroids were removed at that time.
And that would make sense in what we know to be true today. Multiple endocrine neoplasia, typically all 4 glands, if not more than 4,
Right.
are abnormal, revved up, hyperplastic, adenomatous. And so you're not going to be cured until virtually all that tissue is removed.
Right.
And truth be told, for an MEN patient, you can almost never cure them unless you remove every last cell. And that gives you the opposite problem, hypocalcemia, hypoparathyroidism, and we'll touch on that in just a bit.
Okay.
So you went through the one operation, that didn't work. You had another operation a couple years later?
Yes. 4 years later, a new scan came out, the sesame scan, in which there was a dye injected into one of my veins, and it lights up cardiac tissue and parathyroid tissue. At that time, it was real unusual. And I got kind of nervous when everyone starts running into the room. I had a parathyroid tumor on my right ventricle.
Of the heart.
Of the heart.
Yeah.
At this time, nobody knew whether it was a heart tumor or could be another parathyroid tumor. So I stayed down in Miami, and I had a real sophisticated CAT scan with contrast, very thin slices. And they did determine that I did indeed have a parathyroid tumor on my right ventricle. Okay. At that time, I scheduled the surgery for 3 or 4 weeks later, and it was one of the first surgeries that open heart surgeon had done. They went into my chest, made an incision, and went down with a laparoscope type instrument and took out the parathyroid that way rather than doing a whole open heart procedure.
Did that bring the calcium back to normal?
No.
Still high?
High normals.
And you stayed that way for a period of time?
Yes.
This calcium kept being a problem. You didn't have problems that you knew of with the pituitary, eye problems at all?
No, not at all.
And pancreas problems at that time were?
No, but I had been diagnosed with Zollinger-Ellison
So your
syndrome.
gastrin level was high.
My gastrin levels were real high. I had a lot of problems with GERD, acid reflux. I was on phenomenal amounts of Nexium.
And about half of all people with Zollinger-Ellison, one of the big symptoms they have is diarrhea. We talk about ulcers, but people have diarrhea. You had problems with that?
A good day for me would be 15 bouts of watery diarrhea.
That's a good day.
That would have been a good day.
Wow. So back in about 2001 or so, you had a year where you may have had 3 operations to try to get the calcium under control.
Yes.
Looking back into the neck and removing the thyroid gland and other tissues.
Well, yeah, actually, in 2000, I had I had moved to a different area of the United States and had a sesame scan, and they found 2 adenomas in my neck. At that time, it was decided just to go ahead and remove the whole thyroid.